I'd like to thank everyone for attending the first webinar, Mixed Methods webinar series for 2017, brought to you in part by Mixed Methods International Research Association, as well as the International Institute for Qualitative Methodology. Just go over a few housekeeping items before we get is Advances in Mixed Methods Research Design with Dr. Donna Mertens. Dr. Donna Mertens is Professor Emeritus at Gallaudet University with a specialization in research and evaluation methodologies designed to support social transformation. She has co-authored, and edited over 16 books related to research and evaluation methods and human rights, including Mixed Methods Design and Evaluation in Press, Research and Evaluation in Education and Psychology, Integrating Diversity with Quantitative, Qualitative, and Mixed Methods, Indigenous Pathways into Social Research, Program Evaluation Theory and Practice, and Transformative Research and Evaluation. She taught master's and PhD hearing and deaf students in education, psychology, social work, administration, and international development for 32 years. She has conducted professional development related to transformative mixed methods in many contexts. An example, Chile, Guatemala, Australia, New Zealand, South Africa, Niger, Ghana, Brazil, India, Nepal, Sri Lanka, Kazakhstan, and Kyrgyzstan. Dr. Mertens also served as the editor for the Journal of Mixed Methods Research 2010 to 2014. She chaired the MMIRA Task Force on the Future of Mixed Methods, Challenges and Opportunities 2015-2016. Dr. Mertens, we're very happy to have you with us here today. Just put up your slides and we can get going.
Anyway, I wanted to thank Yvette for that nice introduction and also for supporting this webinar series. I'm very pleased to be here to be able to speak with people. Although we don't see where everyone is from, I'm assuming that we have people from all over the world. And an indicator that is important as we try to bring our thinking together about how we do mixed methods research in ways that really can make contributions to the improvement of methodology, but also to the improvement of conditions in society. And so I chose this topic, Advances in Mixed Methods Design, because as Yvette mentioned, I was editor for the Journal of Mixed Methods Research for 5 years. And the articles that we published during that time period, I believe, really do contribute to our improved understanding of how to use mixed methods in research. As everyone's aware, we can't accept every manuscript that comes into the journal, and many times a reason for rejecting a manuscript was that the design of the study was something that was very elementary, that maybe only combined the use of open and closed-ended questions in a survey. And while that can be an appropriate design for some purposes, it's not really capitalizing on the strengths that the mixed methods designs offer to us, especially when we have an interest in trying to understand complex issues within complex cultural contexts. And so what I wanted to do was to share with you some things that I can think of as more advanced mixed methods designs, in the hopes that this will stimulate all of us to think more creatively, more expansively about how can we really make the best use of mixed methods in order to address issues of complexity in the context in which we do our work. And so I wanted to share that with you as really the motivation for wanting to do this webinar. And just to start us off from a very basic place, just to say, what are we talking about when we talk about mixed methods? The combination of quantitative and qualitative approaches in some way in a study And what I have listed there are some, on the second slide, are some very common quantitative approaches, such as experimental, quasi-experimental, causal comparative, correlational survey, and single case designs, and some very common qualitative approaches, some related to group processes like focus groups or some indigenous methods, case studies, ethnographic research, phenomenological research, and participatory action research. If we were to do a study that was only quantitative, then we only collect quantitative data and use one of those approaches, and the same being true for qualitative. But if we're doing mixed methods, then we're including collection and analysis of both quantitative and qualitative data, and this is the really critical factor that defines mixed methods when we see in that next phrase, with integration of the processes and data at various levels and stages in a study or a sequence of studies. And so it's really not a question of simply collecting quantitative data and qualitative data, but looking at it from an overall design perspective. How do we integrate approaches to research that would be characterized as quantitative and qualitative, and integrate those in terms of processes and in terms of data? And when we look at these advanced designs, then we can see that it's possible to do that at more than one level, at more than one stage in a study or in a sequence of studies. And I think using this as a frame helps us to look at the possibilities of designs that do capture that complexity. Now, in the early days, early years of mixed methods development, we often saw designs such as the concurrent design, where you see that the quantitative and qualitative data collection occur more or less simultaneously, and then the dark colored box indicates that there's an integration of those two types of data. This design was talked about by a number of leaders in the mixed methods field, giving us a beginning point. So John Cresswell and Abbas Tashakori talking about basic designs in mixed methods as either the collection of data, quantitative and qualitative, more or less simultaneously as a concurrent design, or in a sequential design where one type of data is collected and then followed by the collection of another type of data. So that could be quantitative followed by qualitative, or qualitative followed by quantitative. So, for example, I did a study on the early interventions available to parents who had young deaf and hard of hearing children. We developed a survey that was quantitative. We sent it out to parents, got back nearly 400 responses, analyzed that data sequentially. Analyzed that data disaggregated by a number of characteristics, and then we wanted to look at those parents who were least satisfied with the services that they had received, and we followed that quantitative survey and quantitative analysis with a qualitative data collection through phone interviews and focus groups to really try to get a richer picture of what it was that contributed to the quality of experiences of early intervention services for this group of parents. And so you see, in that case, it was quantitative followed by qualitative. The integration happened as the use of the quantitative data was used as a basis for making decisions about who to contact and the types of questions that we needed to ask at the qualitative stage. And then in the analysis phase of the study, both the quantitative and qualitative data were brought together to help us to explain what was going on in terms of those parents' experiences. And so these are not bad designs, they're just more simplistic. And so I wanted to show where our field has grown and what kind of designs are available to us that have been used by researchers It would allow us to look at more nuanced experiences, more complex experiences. And what I'm going to do is to introduce the notion of mixed methods as something that I might look at as the anti-paradigm war. That there was a time, and I don't know how old any of the people are who are listening, but there was a time when people from the Constructivist Paradigm and the Post-Positivist Paradigm were engaged in somewhat acrimonious conversations with each other, making arguments that there's only one way that's appropriate to do research, and it's either through the use of quantitative methods or through the use of qualitative methods, and that because of fundamental assumptions that conflict, it's not possible to mix methods. But the mixed methods community came along and said, let's critically evaluate whether or not we really have to stay separate. Is it necessary? Is it possible to find some ground with philosophical backing that would say, hey, mix those methods, but understand the assumptions that are guiding what you're doing? And so from my perspective and understanding of the field, we're operating at a time where there are multiple philosophical paradigms that are influencing thinking in mixed methods, and I characterize those as pragmatic, post-positivism, constructivism, and transformative. And then we have what might be considered to be a meta-paradigm, dialectical pluralism, that Green and Jennifer Green and Burke Johnson have written and talked about, where they suggest that researchers hold on to the assumptions that are inherently definitive for different paradigms, and then they bring them into conversation with each other. So that is the dialectical pluralism, the conversation with each other across paradigms. And so what I want to do is to look at various designs of some complexity that come from each of these paradigms, or each of these paradigmatic positions, I should say, so that you can see what a difference it makes in terms of the kinds of questions that are asked and the kinds of designs that result. So I'll start with the pragmatic paradigm, and this, of course, has been written about extensively by John Cresswell, Vicki Plano-Clark, by Abbas Tashakori. And in this paradigm, what we're talking about is the importance of conducting your research in a way that allows you to get the information that is necessary. So when the researcher has defined a question, then the research design is determined by what needs to be done in terms of data collection to get an answer to that question. So essentially, and this of course is way oversimplifying pragmatism, because if you know, there are many books and chapters written about the meaning of pragmatism and mixed methods. But just to give an overview, I think this is sufficient because it allows us to see how a design in mixed methods would be developed based on the assumption that your methods need to match your questions, and if your questions are of such a nature that you need both quantitative and qualitative data to answer them, then you would use a design such as this. Now, this is a design for a study that was conducted by Michael Fetters and his colleagues, and this particular study was done with women from Japan who were preparing for childbirth, and in the Japanese culture, it was very unusual to have the use of informed consent, advanced consent for an epidural anesthesia. And so the question became one of what is the effect of using an advanced consent for epidurals with Japanese women. And so they began with a quantitative phase, which you can see began with a survey of 82 Japanese women who did take an advanced consent form, and then they had as a product from that attitudes about advanced consent procedures. Then they moved into the second phase of the study, where you see that they had a qualitative and qualitative concurrent data collection phase. So we're seeing the movement from quantitative to qualitative and qualitative concurrent data collection. And in this phase, we see qualitative phone interviews with 18 Japanese women who had the advanced consent procedures. And then from that, they obtained their experiences with advanced consent procedures, but with qualitative data. So understanding what it meant to them and the positives and negatives rather than just numeric data. And then they also, at the same time as doing those qualitative phone interviews, they did surveys that included both quantitative and qualitative questions for 78 health professionals and asked them about the use of those advanced consents. And so from these basically three sets of data collection, the quantitative first being used as a basis for the second phase, they were able to obtain some overall results and interpretation about the use of advanced consent for epidurals. And this allows the health professionals then to understand better what it is that's clear for women in this context, and for the health professionals then to be more responsive to the concerns and experiences of Japanese women. And so they started with a question about what is the effect of using advanced consent, and determined that the best thing to do would be to collect two kinds of data to begin to get an understanding overall of women's attitudes through a quantitative survey, and then to get more in-depth information with qualitative procedures, and then to add the dimension of the health professionals and bring that together in the integration for the overall results. So this is, as you can see, more complex than a simple sequential design. It includes the movement, yes, sequentially, but it also includes a concurrent phase and an integration phase. And so this is a good example of the application of a pragmatic framework for the development of a more advanced mixed methods design. If we go to the post-positivist paradigm, now the post-positivist paradigm has been the paradigm that's most closely associated with the use of randomized controlled trials, or the use of experimental or quasi-experimental designs. And it's also been most commonly associated with the collection of quantitative data. But there have been there have been publications on the design of mixed method studies that overall use the post-positivist paradigm's assumptions, but that are inclusive of the collection of qualitative data. And so I wanted to share that with you because it offers a different approach to the design of an evaluation. And so what we see here in this next example is a study that was done by Peterson and his colleagues. And in this study, the goal was something what we might consider to be very practical, that everyone who gets gets a prescription from their doctor, doesn't always take their medication exactly the way it's supposed to. They are supposed to, and so they wanted to test a number of conditions that would contribute to people actually taking the medications as they were supposed to be taking them. And so what you see here is a three-phase study. And in the first phase, it's qualitative, where they recruited participants, and I guess maybe it should say sequential because they are collecting demographic data, quantitative demographic data. But the main focus of that particular phase one was the conduct of qualitative interviews with representatives of the groups with whom they were concerned. They had groups that experienced depression, they had groups that had hypertension, and they had groups that had asthma and cardiac problems. And so they wanted to understand the experiences of getting a prescription related to these three groups, and what was it like for them? How did they explain their decisions about whether or not to take the medicine, variables that might interfere with their actual completing taking their medication as it was prescribed. And so they used that information from that first phase to design an intervention that you see under phase two, where we see concurrent mixed methods. And in that, they did use a randomized controlled trial, but on a very small scale. And they pilot tested using control and experimental conditions. So they had two conditions for each group, and the groups were divided by depression, hypertension, and asthma and cardiac group problems. So they did separate analyses, separate implementation. They gave baseline questionnaires, which were quantitative. They conducted follow-up interviews with those pilot participants, which were qualitative and quantitative. And then to add to the understanding, they collected data each week where they had team meetings to review the participant and the interviewer's feedback. And so from that, they developed the final study protocol. So you see in that second phase, still the use of a randomized controlled trial design, but it's supplemented by the collection of qualitative data with interviews. It's supplemented with qualitative data from weekly team meetings. And then that information is being integrated for the development of a study protocol when we move to phase three. And we see here a full-blown randomized controlled trial with a much larger sample size, assigning participants to experimental and control groups, the collection of baseline data for each group, stress scales, depression scale, exercise scale. So those are examples of the kinds of scales that they used that yielded quantitative information. They also, during the process of the study, conducted bi-monthly phone calls to assess what was going on during the interval and to talk to people about their health behavior. In addition to the collection of scale-based quantitative data, participants in the hypertension group used electronic pill monitors. So this is something that's electronically based that can provide information as to when people are taking their pills and whether or not they're taking the appropriate dosages and so forth. And for the asthma and cardiac groups, they also collected quantitative data on kilocalorie per week index. And then at the end of the intervention, they again administered the baseline measures in order to determine the effects of the interventions. And so what we see here is a predominant concern with randomized controlled trials, which was primarily seen in phase 2 and phase 3. But in phase 2, we also see the collection of qualitative data to supplement the understandings that were being gained through the pilot testing, and a predominantly qualitative collection of data in phase 1 that it helped inform the development of the interventions for phase 2 and for phase 3. And so I think it's important for us to realize the diversity of perspectives within the mixed methods community and how we can share this ground and have mixed methods designs that are more complex but are still true to the assumptions of particular paradigms. So let's move on to the Constructivist Paradigm. The Constructivist Paradigm is most commonly associated with the collection of qualitative data with the notion that interviews and observations, document reviews, that kind of collection of qualitative data is what allows a researcher to understand the various versions of reality, and that those realities that we try to capture in a research study are multiple in nature and that they are socially constructed. Now, if you're working from this paradigm, then what does it look like to add mixed methods to a design? We might ask different kinds of questions. Recall that in the first two examples, we were asking questions about how well does this work, how well does an intervention work, but we see in this slide some questions that Charlene Hesbiber raised in a discussion of the application of a constructivist framing of mixed methods, that you would ask questions such as these, like how well do the recruitment procedures work? How well does the intervention respond to the culture and context of the target population? To what extent does the target population reflect the range of diversity with regard to the overall goals of the project? Who is left out? Why? You notice that these were not the primary questions that were identified in our first two example studies. The fourth question, to what extent is ethics practice built into the recruitment and evaluation process? How well does the target population understand what they are consenting to? And to what extent do participants accept the outcomes of randomization? Are participants willing to be randomized? Now, this is a question that comes from a constructivist viewing that participants may have very different views about the willingness to participate in a study in which they are randomized into an experimental or control group. And with a constructivist lens, part of the resources for the research would be expended to determine the perceptions of participants about being in a study in which part of them receive a treatment and part of them do not. We're seeing more and more voices of communities saying, you know, we don't want to participate in a randomized trial if we're not going to receive the treatment. And so it raises an ethical dilemma for researchers about how to handle that. And just as an aside, I will say that it's possible to provide people with the next best treatment rather than a placebo or no treatment as a solution to that ethical conundrum. But witnessing the will of the participants as a part of the design would be something that would come up under the constructivist paradigm more strongly than in the other paradigms that we've looked at so far. So here's a study that was conducted by Puchel and Thompson in Chile. It's one that Hesbiber actually discussed. And what it is that women in Chile were allowed to receive free mammograms by their health policy. But after 3 years, the medical services realized that there was a real lack of uptake of those services. And so what we see here is a 4-stage design in which the recognition of the problem that women are not taking part of these services, that quantitative and qualitative data were collected, one particularly through the qualitative data through a grounded theory study of women's experiences and barriers. And the methods of data collection included focus groups, observations, and field notes. The quantitative data were demographic data and data concerning the frequency of services and disaggregated by different characteristics of the women. They moved from this stage to stage 2, a qualitative stage, in which they used the information from stage 1 to construct a modified intervention and then to design a randomized controlled trial. So we see here that even though it's coming more from a constructivist point of view, there's still inclusion of a randomized controlled trial. And as we move into stage 3, sequential collection of quantitative and qualitative data, we see the number of mammograms as quantitative data that was collected, and then a continuation of observations, field notes, interviews, and surveys throughout the process of the implementation of the interventions during stage 3. So that data the data that was collected in terms of the qualitative became data that could be then used to define the intervention and also to continue the data collection of quantitative and qualitative data in stage 3 during the implementation of the intervention. And then we move to stage 4, where concurrently quantitative and qualitative data were collected. Again, the quantitative data were the number of mammograms that were taken, also disaggregating data to look at behavior change. Women who had not previously taken up the practice of having mammograms had changed behavior or not, and then qualitatively, again, follow-up interviews to determine the factors that influence women's decisions about whether or not to participate in the study and to take up the services. And so here we see that qualitative understanding of women's experiences is given priority with a testing of interventions through the use of randomized controlled trials. Now, we'll move on to the transformative paradigm as a 4th paradigm that supports the use of mixed methods. The transformative paradigm is one that puts priority on issues of social justice and human rights and